Hi everyone, this video is about croup and hopefully will help answer some commonly asked questions that I get. So croup is a viral infection that infects the entire upper airway, particularly the voice box. The reason that's a problem, if you think about it, when you're tiny, you have a tiny airway, and when you're an adult, you have a large airway. Well, those little tiny airways, if they have some edema or swelling, they could get dangerously small so that they couldn't move air through their upper airway. So croup is characterized by typical cold symptoms: clear runny nose, we call it rhinorrhea, nasal congestion, cough, sometimes fever. The way you can tell the difference with croup and a regular cold is by the sound of their voice. They have a certain hoarseness, harshness to their cough. The cough sounds like a seal bark is how we describe it, which is something like ho, 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 a very harsh, weird sound, almost like a bark. Well, that's dangerous enough and sounds terrible, but then the true emergency situation with croup would be on inhalation. As they breathe back in, if they make a high-pitched inspiratory squeal sound like that means that that little tiny airway is getting dangerously small and they're not able to move air adequately. And that is a true emergency on the level of 911 for EMS transport or direct trip to the emergency department. But first, let me tell you about some supportive care measures you can try at home for croup. Now, remember, because croup infects different ages differently because of the size of the airway, this is not typically a problem after about age 5. It varies with the size of the child, obviously. If you have a child much older than 5 and they're routinely still getting croup, your pediatrician is probably going to want to refer you to an ear, nose, and throat specialist so they can look inside and make sure there are no anatomical abnormalities that are predisposing them, giving them a chronically small airway to begin with, making them more at risk. So let me tell you about some tricks you can try at home to hopefully avoid any dangerous situations with this stridor. You can try all your routine measures for a normal cold for a baby or toddler. Saline drops to the nose, bulb suction syringe, although honestly, with croup, you don't want to really make them very aggravated because they can become in more distress. So as much as you can get away with without really ticking them off, because it makes them get into more respiratory distress if they're really fighting or upset. So elevate the head, run the cool mist humidifier, encourage fluids. But if the baby gets into a coughing fit and you're hearing that barky cough, try taking the baby into the bathroom with the steamy shower going and let them breathe in all that moisture, and it can break up this cough a little bit. If that doesn't work, you can take the baby, wrap him in a blanket to the front porch, and let them breathe in some cold night air. Now, if this is happening to your baby in the middle of the summer, you may have to open the door of your freezer and let them breathe some cold air from the freezer if you don't have any outside. Now, remember, as always, these videos are just hopefully common sense practical tips for parents, and this does not always apply to your individual child. You should always ask your pediatrician. And as always, if you ever see signs of true distress in your baby, flaring their nostrils, grunting with each breath on expiration, breathing with extra muscles so that their ribs are coming up and down or the skin's going in between their ribs, or using a lot of abdominal muscles to breathe, or breathing very fast, hard, or heavy, then of course you need immediate attention. But hopefully this will help with some supportive care measures for croup and knowing when you're in trouble with stridor. The treatment in the office when you go in will be steroids to reduce this inflammation in the airway. And so I often tell parents it couldn't hurt to use, after 6 months of age, ibuprofen over Tylenol, as it also can have a little bit of an anti-inflammatory effect, but usually not enough. Usually it does take steroids. So that'll be the most common course of action once you see your child's pediatrician. Hope this helps. Thanks.